Dr. Taliancich-Klinger is a bilingual speech-language pathologist and associate professor at Our Lady of the Lake University. She is also author on the newly released book, Goal Setting in Speech-Language Pathology, and we are fortunate to have her as project director here at WPS, which is why we are so excited that she is presenting a webinar on best practices for assessing dual language learners. Assessing the language characteristics of Spanish and English speaking students is her specialty and the focus of her research. Dr. Taliancich-Klinger, thank you very much for joining us today and talking a little bit about the subject matter of this webinar.
Sure, I'm happy to be here. Thank you for asking me to come in and talk about this really important topic.
It is so important. There are about 5.3 million dual language learners in the United States public school system today, but most educators and practitioners are not multilingual. I'm wondering if you could talk a little bit about the challenges that can arise because of those language differences.
Sure. Gosh, this is such a passion of mine, and you bring up such an important point about the mismatch between the demographics of a lot of the teachers and clinical professionals. So, for example, the majority of speech-language pathologists are English-speaking speech-language pathologists, monolingual English speakers, and that does not match the demographic of the patients and clients and students that we serve professionally. And this can create a lot of challenges when trying to decide whether or not an individual is exhibiting a language difference. So a difference between both of their languages in their language learning trajectory, or if this individual may actually exhibit a true communication and or learning disorder. These things are often very blurry, can be blurry lines. And when one does not speak both languages of the person you are serving, it can be really difficult to tell if this is a difference between two languages or a true impairment. And so it's really important to understand aspects of bilingualism and learning two languages and how those may impact especially a young child over time.
More and more practitioners and educators are moving away from looking at issues like this through a deficit lens, and we're moving more toward a strength-based approach. And I'm wondering what your thoughts are about the strengths and the assets that multilingual students bring to their own educational process, but also to the learning environments that they're in.
Sure. I love that. I think it's really important to focus on an individual's strengths. And you know, our dual language learners, our young dual language learners know that they speak more than one language. And I definitely think one of their greatest strengths is their ability to pull from both of their languages. A lot of individuals learning two languages know that they may have a gap in one of their languages in one area. For example, they may not know a certain word for something they're trying to say. And a lot of times what a dual language learner will do is they will pull that word from another language to fill in that space. Some people interpret this as confusion when I interpret this as this is an amazing skill that somebody has. They are pooling their resources to be able to communicate effectively. And so I think a lot of our dual language learners go back and forth between their languages, and that is a show of their incredible strength and cognitive abilities while they're learning their languages.
So now we're getting to the real meat of what you're going to be presenting in this webinar. How can speech language pathologists, educators, and other people in the assessment world really hone their ability to meet the needs of these dual language learners, especially when it comes to assessment?
So we've got to start off by asking some really important questions. You know, every dual language learner is going to look a little bit different in terms of their language experience. And what do I mean by that? So, I mean, I can have two individuals who, for example, may grow up speaking English and Spanish in their homes, just as an example. Both of these individuals, though, may look very different in terms of how often they spend hearing each of those two languages over their lifespan. And so this is going to mean that their language skills are going to be distributed across English and Spanish, not duplicated. And that's one of the really important things to understand when we're doing an assessment. Just because somebody exhibits skills in one language does not mean that they are duplicated across their other language. And so we need to make sure that we are looking at both languages to see what skills an individual has, and then at the same time, what skills an individual may be lacking or what skills are emerging, etc. So we need to be asking questions like, how often is this person hearing English and Spanish? And when they're spoken to in one language, what language do they respond in, etc. All of these things can potentially be different across every dual language learner. Bilingualism is a very dynamic phenomenon. It's not something static. And so I'm always talking about, it's not enough to ask someone, are you bilingual, yes or no? There are other questions that are going to follow for us to get a better understanding of someone's actual language experience. And all of those things are going to impact our assessment process.
Can you share a little bit from your own experience about what it is like to equitably meet the language needs of students who are dual language learners? Can you tell some stories or share a little bit of your own on the ground experience?
Sure. I am a pediatric focused clinician. I have worked across the lifespan. The pediatrics are my passion. And so I spent a lot of my time working clinically in home health settings. And so I was actually able to go into homes and do a lot of dual language assessments for children. And something that I would come across a lot was guardians, parents would say, well, I think my child is confused because we speak more than one language. And I continue to hear this today. And so it's unfortunate because we know that there's no evidence to support that that is the case. And so I spent a lot of time talking to families about the importance of bilingualism, the importance of dual language learning, and what those language learning trajectories might look like for a child. I did a lot of assessments, and I would assess in both languages. I also speak Spanish myself, and so fortunate enough in that way where I could do an assessment on the child in English and then evaluate skills in Spanish as well. We would often see a difference between performance in the two languages and discuss kind of what those things mean. We would identify areas, for example, if the child exhibited a communication disorder across both of their languages, we would discuss ways to support in the home in both languages, not just in one language. Something else that I commonly would come across is after talking about the results of an evaluation where maybe the child exhibits a communication disorder, I would get questions of, well, is it better that we just use one language? And the answer is no. So in the case of, for example, developmental language disorder, we would definitely want to continue to support both languages because individuals who exhibit developmental language disorder need a lot of repetition. They need a lot of repetition. They need a lot of input. And if we were to take away one language, that's taking away an input modality for that child. And so we would have a lot of discussions about making sure we're supporting language learning overall, whether that be in English and Spanish, for example, in the home, and then potentially at school. So I've really loved working with families and talking about the importance of dual language, the importance of maintaining the heritage language in the home to make sure the child feels connected to their culture, connected to family members that may come for extended visits, etc. and also advocating for parents and families so that they can advocate for the language needs of their child in schools and with other professionals that they may encounter.
What an amazing set of experiences. This is going to be a really powerful webinar, and I feel like it's going to up-level a lot of skills and improve outcomes for a lot of students. Thank you, Dr. Taliancich-Klinger, for spending some time to give us a little glimpse of what's coming. I appreciate it.
Thank you for having me. I'm looking forward to it.
Thank you.